Hi friends, today I will explain about Menieres disease. Menieres disease is a disease of inner ear. Uh, the Menieres name is came from the name of the doctor who is a French doctor. He identified the first this disease. So his name is contributed for this disease. It is also called as endolymphatic hydrops. Hydrops means accumulation of excessive accumulation of fluid in the cavities or extracellular fluid. It is called hydrops. Here in this disease, endolymph is excessively accumulated. So it is called as endolymphatic hydrops. Hydrops means accumulation of excessive accumulation of fluids. In which endolymphatic system is distended with endolymph. Uh, Already I explained about inner ear structures. Please go to that video and see that video. Then you can clearly understand the structures and thereby you can interpret these disease with anatomical structures. Endolymphatic system is distended. Why? Because it is this is endolymphatic system. Here when there is the accumulation of fluid, this is distended with endolymph. It is characterized by four four symptoms. One is vertigo, another is sensory neural hearing loss, tinnitus, and oral fullness. Vertigo is a uh, it is characterized by nausea, vomiting, the person feeling that the surroundings are rotating around him, and he can also feel that he rotating around himself. It is all associated with nausea and vomiting. After I will do lecture on vertigo also. Tinnitus is a ringing sound in the ear. It is called tinnitus. Sensory neural hearing loss. Already you know that there are two types of hearing loss. One is conductive hearing loss, another is sensory neural hearing loss. This Menieres is associated with this sensory neural hearing loss. Conductive hearing loss is characterized by there is any obstruction in the external auditory meatus or middle ear. It causes the conductive hearing loss. If there is any lesions in the uh, internal ear and related nerves, it gives rise to sensory neural hearing loss. Oral fullness, it is the feeling of fullness in the ear. Physiologically you feel this in the during swallowing, during uh, yawning process. You feel that there is a fullness in the ear. This is physiologically. If anyone affected with this disease, they feel that always there is something in the ear, it is filled with the ear. They feel that this feeling is oral fullness. This combinedly gives the Menieres disease. uh, there is no must and should all things are present. Sometimes vertigo only present, sometimes tinnitus, sometimes vertigo is present earlier stage, and then later stages vertigo is resolved and hearing loss is approached in the later stages. This is combination of these features, that is there is mandatory to present all features in the Menieres disease. It is not possible in one patient. It may be come one by one, all are present end stage. This is the Menieres disease. First we will focus on the production of endolymph. uh, Already you know that structure of the inner ear. There is membranous labyrinth and bony labyrinth. And membranous labyrinth only filled with the endolymph, and bony labyrinth is filled. There is space between the bony labyrinth and the membranous labyrinth, it is filled with perilymph. The stria vascularis is present in the scala media. This is responsible for the production of endolymph, and this produced endolymph is passes through the membranous labyrinth and it absorbed in the endolymphatic sac. One of the condition, it is albinism, where the endolymph is decreased. Why? Because the process of production of endolymph requires melanocyte. In the albinism, there is decrease in the melanocytes, so it leads to the decrease in the production of endolymph. This is the production and absorption of the endolymph. If in Menieres disease, the defect in these two steps only leads to the Menieres disease. If there is any defect in the production which leads to the excessive lymph, and there is any obstruction in the endolymphatic sac which defect the absorption process, these both leads the progression of Menieres disease. Now I will explain pathology. Already I said normal production of endolymph. Always endolymph moves from cochlea to the endolymphatic sac. Why? The cochlea is the site of production and the endolymphatic sac is the absorption site. So endolymph moves from cochlea to endolymphatic sac. Any disturbance in the production or absorption or both leads to the accumulation of endolymph in cochlea and membranous labyrinth. If there is accumulation in the cochlea, it leads to the hearing loss. If there is accumulation in the membranous labyrinth, which leads to the vertigo. And this is also pathology in deep due to etiological factors. Any etiological factors which leads to the Menieres disease leads to the overproduction or defect in the absorption of the endolymph, or both conditions leads to the increase in volume of the endolymph, which leads to the increase the pressure in the membranous labyrinth, which leads to, when there is pressure increased in the membranous labyrinth, which these pressure waves are transmitted to the organ of Carti, which leads to the misfiring. Which leads to the misfiring of vestibular nerve, and due to the pressure there is a distension also. How it will be? This is endolymph fluid. Scala media is filled with endolymph. When there is increase in pressure or volume, this pushes the regionous membrane, which is it is called regionous membrane, which bulges out into the scala vestibuli. Into the scala vestibuli, which further leads to rupture and mixing of this endolymph with the perilymph, which is present in the scala vestibuli. There is the mixing is occurred when there is rupture, which leads to the electrolyte disturbance. Why? Because it will happen. Endolymph is full of potassium. Why? Because this endolymph is intracellular fluid. The perilymph is extracellular fluid. Always remember that extracellular fluid is rich in sodium. So perilymph is rich in sodium. Endolymph is rich in potassium. So there is mixing of electrolytes. There is disturbance in the electrolyte. So it leads to the symptoms of Menieres disease. This is the pathology of Menieres disease, how it occurred and how it progresses to form the symptoms. Now I will discuss etiology. What is meant by etiology? Etiology, the factors which causes the disease. described as a etiology. Etiology, if there is defective absorption, already I said in previous paper, defective absorption. It is experimentally proved. How it proved? If there is any obstruction to the endolymphatic sac, these increase the volume in the membranous labyrinth and also which leads to the increase in the pressure, which leads to bulging of the Reisner's membrane into the scala vestibuli, which further leads to rupturing of the Reisner membrane. There is mixing of endolymph with perilymph, uh, which may cause electrolyte disturbance. These are the responsible for forming Meniere's disease and its symptoms. Vasomotor disturbance. Vasomotor disturbance means the nerve supply to the vasculature is vasomotor. The vasomotor maintain the tone of the vasculature. If there is any disturbance to the vasomotor, it leads to the Meniere's disease. Now I will say how it will happen. So vasomotor means sympathetic overactivity, which leads to the spasm of internal auditory artery. If there is spasm to the internal auditory, it occludes, which interferes the sensory neuroepithelium. How it will happen? The internal auditory artery supplies the neuroepithelium and the inner ear structures. If there is any spasm to that artery, there is ischemia of the respective organ. Here the neuroepithelium is interfere in this action. It responds to the deafness and vertigo. Why? Because nerve supply is compromised. It leads to the ischemia and there is loss of the nervous structure. There is sensory neuroepithelium structure disturbance in the area. Anoxia of capillaries of stria vascularis. Anoxia means deficient in oxygen, which leads to the increased permeability of the stria vascularis. There is transudation of the fluid into the scala media, which leads to increase in the endolymph, which further progresses in the Meniere's disease. This is the vasomotor disturbance. Third one, allergy. 50% of the patients of Meniere's disease has a history of allergy. So it suggests that allergy also contributing the Meniere's disease. In this case, inner ear acts as a shock organ, thereby increasing the endolymphatic organ. In the allergy cases, the inner ear acts as a shock organ, which leads to the production of overproduction of endolymph. Sodium and water retention. We know that sodium follows the water follows the sodium. So if there is sodium retention, the water also follows. So there is increase in the endolymph, so which leads to the endolymphatic hydrops. Previously I told that what is meant by hydrop. Hydrops is excessive accumulation of the fluid in the cavities or ECF. Hypothyroidism. 3% of Meniere's cases is there is history of hypothyroidism. Why? Because um, in the condition of hypothyroidism, there is a underdevelopment of the neurons. So it leads to this cochlear nerve also now which affected during hypothyroidism. So 3% of cases suggest that hypothyroidism also causing the Meniere's disease. Sixth one is autoimmune and viral etiologies also producing the Meniere's disease. Uh, there are many laboratory and the experimentally observations suggesting that autoimmune and viral etiology is also producing the Meniere's disease. This is overall picture what the factors which causing the Meniere's disease, and Meniere's disease leads to the following symptoms. These are the clinical features of the Meniere's disease. defective absorption, allergy, autoimmune and viral infection, stress, sodium and water retention, hypothyroidism leads to the Menieres disease. The Menieres disease leads to following clinical features. These are episodic vertigo, fluctuating hearing loss, tinnitus, and oral fullness. These are the clinical features of the Menieres disease. In next lecture, I will explain the clinical features and types of Menieres disease. Thank you for your